The state of women's health in Ethiopia is very different from the women's health as we know it in the United States or in the western part of the world. There were 6 countries that accounted for about 50% of the maternal mortality in the world, and that includes Ethiopia. If you look at the example of Ethiopia, there are a population of 90 million. There are only a few hundred OBGYNs, so the ratio of obstetricians to the general population of women is about 1 to 1.8 million.
This all boils down to the quantity and quality of health services we deliver in country. The challenge is there is a family planning issue. There is the need for having continuous antenatal care, at least 1 up to 4 visits. And there is also issue of delivering in health facilities. So if the mother is fine, it's likely that the child, which the newborn, is going to be fine. So it's a continuum of care we're trying to build.
The Center for International Reproductive Health Training will be at the University of Michigan. The main purpose is to integrate reproductive health training into medical education. We'll start out by training physicians. The ultimate goal is to play an active part in reducing maternal mortality by fulfilling the unmet need for contraception and family planning that's currently not easily available in low resource setting. We were able to establish the center with a very generous grant from an anonymous donor.
Recently, I just learned that the University of Michigan has close to 4,000 doctors. Ethiopia, as a country whole, which has about 90 million population, has 4,200 health professionals. So you can imagine the number of doctors in University of Michigan alone, forget the whole United States, is exactly equal to the number of professionals we have in the country. So you can imagine the proportion, the very bedrock, the very underlying bedrock why this program has been developed and which is likely to be expanded after this is due to the limited number of health professionals we have in country.
It's not a one-way street. We get out of it as much as we put in. We have a tremendous opportunity to take our trainees with us, where they see diseases in a very advanced stage, where they see very different kinds of disease pathology from what they see here, as well as a great opportunity for us to collaborate and research in other areas. Whether you live or die, or whether you have access to good care or not, shouldn't really depend on where you live. So as an institution, we have committed to take a very active part in improving women's health, whether when women are in the south or north or east or west.